Yes.
Hello, everyone. I am so happy. This was such a cool thing. Thank you. Thank you, Tyson, for allowing me to share my passion, to share a few cool stuff with everyone here. So instead of me deciding what I want to kind of share and walk you through some techniques, I want to ask you, is there anything specific that you guys are looking forward to? So some of you that don't know me, because I don't want you to throw out like really hard stuff that I don't know. I'm a pain resolution practitioner. So I'm a licensed medical massage practitioner, functional nutritionist, and genetics, translational genetics practitioner. And what I teach is very advanced, unique self-help pain relief techniques. So this is why we're here today, for me to share some cool stuff with you guys. But like I said, I would love to share techniques that it's going to be very useful for you, for if you're going through something. If you don't want to like type it in the chat, you can send me a private chat message. If you want to be kind of like, you don't want to share with the world, I'll be happy. I won't mention your name. I'll just kind of, if I have a unique technique with that, I'll be happy to share with you. With saying that, I'm not seeing anything. No one's jumping. So, Laura, you got something?
This isn't working. I was trying to click it. It's not working. I do. Other than the whole gasping, which you've already helped me with a lot in about 5 minutes, I think it was, that you taught me how to do some stretches. Lately, my hip has been bothering me to the point where that's my favorite hip to sleep on. And now I'm having sleeping issues because it's so sore. It feels achy, and like if I turn the wrong way, I just get these sharp pains. I'm like, I don't know what's going on, and my doctor's so far away. How do you help me?
So is it okay if I ask just a couple of questions? So tell me what part of your hip exactly hurts, and can you describe the pain? Is it sharp? Is it dull? Is it localized? Does it refer anywhere?
So it's in the side joint of my hip, not in the back, not in the front, like right in where that joint is on the side. Usually it's a minor dull pain, unless I'm leaning on it. Then it's a deeper dull pain. But as soon as I twist or turn or put heavy weight on it, that's when it's a sharp pain. And I'm like, ow. I'm doing something wrong. Please don't fall to the floor.
It's a localized pain.
It is localized, yeah.
Okay, so it could be a couple of different things. It could be just inflammation. It could be that sometimes, depending what part of your hip, you have the TFL, tensor fascial latae muscle, and that sometimes, which continues to become your IT band, which goes side of your leg down to the knee. And a lot of times that pain, actually, the source of that pain can start at your SI joint. So it's hard for me right now to lay down and show a technique. But if Tyson, I don't know if I am allowed to share my screen.
Sure can.
If you allow me to share my screen, what I can do is, with your permission, I can share a self-help technique video that you guys can, it's very short video. It's how to release your SI joint. And that's something you can try, and then you can get back to me.
Is that the one where you're on the table and you put your leg over the table?
No.
Oh, okay.
No, these are very weird, unique techniques. Like I said, let's see.
Maybe Ani,
just-
if you want to send the link, put the link in the chat to the video rather than
There
sharing.
is no link because I never give full access to these videos. I just give temporary access to the videos,
Okay.
like a 2-day access, and then the thing expires. But I am going to open it up right now and share the screen. Yeah, these are videos that I usually, like I said, I don't give access to anyone because they're going to be in my course.
Mm-hmm.
So even when I give access to my patients, it's like a password and 2-day expiration. That's it. So I'm going to share this with you. And this is specific for sacroiliac joint, okay? And like I said, it's a very short, few second, like 21-second video. And then you can tell me, is it, come on. Sorry, I gotta move this so I can hit play. Face down as I release. Bend your knees 90 degrees. Make sure your knees are wide open. You're doing a knee walking. Don't lift your knees too high up. Make sure you incorporate your hips with the movement. Repeat 20 to 30 seconds. If pain persists, stop the exercise. That is it. And I'm sure you guys will have the recording. So you can always watch, right, Tyson? So you can always like go back and watch that technique. But that's an amazing SI release. And like I said, that can translate to your TFL side of your hip pain and go down to your IT band.
Laura's on the ground. She's underway. She's going for it. I'm not sure if you can see the comments here as well.
I am. I'm actually reading. Yeah, I'm reading Amy's comment, and then Esther, I got your direct message. I will address that, but Amy's was before.
Cool.
So with the respiratory stuff, one of the easiest thing. Oh, let's see. Let me say the respiratory stuff first. If I'm at the office, usually with the clients with the respiratory infection, I mean, it's an infection, I'm not a doctor, so that's outside of my scope of practice. But one of the few things that we can do in a medical massage if you get someone on your back, just do tapping like that. That would release it. That would relax the muscles. One of the things I love to suggest is castor oil packing. I would do castor oil packing on the chest and on the back. And I would put, usually I have my castor oil like packed literally here. When I sit and watch TV, I just slap it on my liver. And I have a infrared heating pad, red infrared pad. And I would put on it because it allows castor oil to penetrate deeper into the tissue. So try that for that. And then you have an old hip injury from fall, feel like my ankles are tight, have some PT exercise, I'll give them that. Yes. The hip injury, is it like an accident? What kind of trauma?
Yeah, I've been to physical therapy for it, so I've got some exercises, but I fell and one leg went like whoosh out from under me and the other leg like went to try to catch me and the hips went choo, 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 choo. So it was some years ago. And so it's like when I feel my hip bones, they don't feel like they're even, but the doctors and the scans said like it's nothing to really worry about, that I just need to strengthen my quads is what they're having me work on. But sometimes what happens is when I sit too long, like I'll notice it hurts, like I'll notice it more if I'm doing a lot of Zoom meetings and I'm not moving enough, or sometimes when I wake up in the morning. But usually it's from sitting too long that they start to hurt more. But it's not like so painful that it prevents me from having my life. It just, you were asking for people to note. I was like, my body was like, tell her everything. So I was just putting
No,
all my
that's cool. I love it. I love it.
Thank you for
So
asking.
I'm actually, that's really cool. One of the things you can definitely do try the SI release, but because you had injury like slip and fall, when that happens, our autonomic nervous system goes into upregulation, gets upregulated. And it doesn't matter if you've done physical therapy, a massage, anything, when someone doesn't go and down-regulate that autonomic nervous system, it could be that you had accident 15, 20 years ago or longer, your system stays upregulated. So I was thinking of actually sharing this technique with you because you can use for anything, any trauma. Sometimes when a client comes to my clinic, I check their whole body from bottom to top, and then I start releasing from top to bottom. But sometimes when I'm just touching their body, they would do the withdrawal reflex. That tells me they're running on sympathetic nervous system. They're constantly, their adrenals are just burning. Or when I go to palpate their rib cage, like 6 to 12 ribs, they're like, oh, I'm ticklish, or they still withdraw. So this technique that I'm going to teach you, it's an awesome technique. It works every single time, and it down-regulates your autonomic nervous system, okay? All you need is a couple of pens, pencils, straw, chopsticks. I don't care what you take. You're going to have to do this actually laying down, but you're going to put the pen or pencils in your ring finger, like ring finger stays out. Okay, you try to spread your fingers, but sometimes people get the pencil, do like this. No, only the ring finger stays out. All the other fingers are spread out. So you're laying down, your hands go over your head. Hopefully that's comfortable. You're gonna curl your toes under. Sometimes I ask the people, get a straw or something to hold the pen or pencil or straw under your toes also. But sometimes it's hard for people, so I just tell them to curl their toes. You close your eyes and you lay there for about a minute. Okay? As you're laying there, what I want you to do is collect some saliva in your mouth and hold on to it. And then after about 10 seconds, you swallow. And then you, again, collect some saliva in your mouth, hold on to it. In about 10 seconds, you swallow. After 1 minute, you're done. So then when I'll go to palpate again, touch, they're not ticklish anymore. They don't have the withdrawal reflex anymore. So try that for sure. That should help because of your trauma. The swallowing enhances, it's part of your vagus nerve down regulation, because every time the part of the swallowing reflex, just the part you swallow, that actually stimulates your vagus nerve. Hopefully that was helpful. Awesome. Okay, let's see. I'm just going to read what Esther put in. Oh, awesome. Thank you. I love that. Okay. So this is a technique I wanted to teach you guys because when I said I just came back from my office and I had a brand new client, 28-year-old kid, major neck pain issues. And I barely even touched his neck. I just kind of palpated to feel the tightness. But after this technique that I'm going to teach you, 2 techniques, his neck was almost 90% softer. And I barely even touched it. A lot of the neck issues is coming from your jaw, from clenching, grinding, tongue tight. And people like, my tongue is tight. Yes, your tongue is very tight. And the muscles that connected to it, the cranial nerves, there's 5 cranial nerves innervate in your tongue. So when we release the tongue, it's amazing what release you can get. Root of your tongue, sorry, I'm going a little anatomy. Root of your tongue is attached to your hyoid bone. there are muscles attached that attaches all the way to your mastoid bone. The other one attaches all the way to your angel wing, your scapula. Imagine once I release the tongue, so much of your neck just goes, relaxes. So the first technique I want to teach you is for your jaw, to relax the chewing muscles, your masseter, your temporalis. Under yours, just behind your mandible, you'll touch with your thumb, you should feel soft. Just keep your thumb right there. Now push tip of your tongue to the roof of your mouth and feel what happens under your thumb. It should become harder, like rubbery, right? Do you feel that? Okay, just hold that about 20 to 30 seconds. The only thing, don't do what Laura does, don't do this. Because people concentrate on that so much, just keep your head neutral. And just hold that for about 20 to 30 seconds. That relaxes your, like I said, your masseter, all the muscles of mastication. And yawning, Laura, I think we talked about it a while back. Yawning is a sign of release also. So that's one of the techniques. Now, the next technique, you may need a tissue or something. Usually in office, I use gloves. But if you feel comfortable, it's your own hand because you're going to be touching your tongue. And that is one slippery little sucker. So it's like slides, your fingers slide. But what you're going to do is stick your tongue out, not a lot, just like you're sticking your tongue at someone. Try to grab on from both sides and like you're giving a slight pinch. Once you feel like you got the hang of it, the tongue, stop sticking out. You hold on to your tongue. And as you're holding on for about 10 to 15 seconds, you're going to gently, like almost like you're like doing this little tiny massage of your tongue. Sometimes I use tissue, but the tissue may stick. Do what Laura does. And as you're massaging slightly, very gently pull it out. So you'll feel that gentle pull. And you most likely will feel that in the back of your neck as well. So that would actually release the neck, the back of the head where you have your subscapularis, that area, that would feel the relaxes the back of the neck. Hopefully that was helpful. Do that. Honestly, I have a client when she used to clinch and grind a lot her jaw. Once I taught her this technique, the addition to it, whenever you feel stress coming on, when you're like in a stressful situation or conversation or whatever, you know, one of the few things that happens is our head gets locked up, right? Everything here starts tightening. So then your breathing changes. I taught her to do this technique. At the same time, you turn your head, whatever your dominant hand is. So if you're right-handed, turn your head to the right and hold that the same, 20 to 30 seconds. What that does, it changes the pattern. It doesn't allow your neck to tighten up once you turn your head to the side. So that's another technique of stress release. And she says, since she started using that technique, she doesn't clinch or grind her, doesn't clinch. I can't say grinding, but doesn't clinch her jaw anymore.
So question, Ani, when it comes to that exercise, would you recommend doing the tip of your tongue to the roof of your mouth like in different sets, or would you just do the...
No, just once. Just once, 30 seconds, you're done. You can repeat that several times a day, as many times, like sometimes I'm driving, I would just do it, or I'm sitting, you know, working on a computer, I would do it. But, you know, sometimes I would go and just palpate here and I feel any tightness, then I'll go ahead and do it.
Yeah.
So you can repeat several times, but no, you just do one and you'll feel it loosens up.
Okay. So would you recommend someone if they're like, as soon as they notice they have a sore neck, they would do that exercise, then probably do that again, leaning to the left or right,
Yes.
and to release all of that.
Well, to lean to the side, that's for stress. To relax the neck, that's you do this, and then you would do the tongue. And then depending on the neck, if you have like a neck range of motion issues, that's a completely different technique. So let's say you can turn your neck much easier to the right, but not so much to the left, right? This technique is really cool technique and it works every single time. So let's pretend I have a difficulty turning my head to the left. So you put your finger to the right, to your right. So your eyes on a corner, like you're doing a peripheral vision. So your eyes are looking to your finger. And very slowly, you're going to turn your head to the side where it's difficult to turn. And you always look at your finger. Keep looking and turning your head. When it comes a point that your neck hurts, you stop. You come back neutral again. Okay? And then you repeat. As you're looking at your finger, make sure, I mean, you're going to move your finger with you, but always make sure you're looking the far right, the very periphery. And so what happens, some of you may feel like it gets a point when you feel this weird feeling in your head, the weird thing behind your eyes, because, your eyes want to follow wherever your head goes, right? And you're forcing something completely opposite. So you get these weird feelings behind your eyes and your head. Don't worry, just go with it. You do that a few times, I guarantee you your neck range of motion increases. I've never had a client that it didn't work. So that's a really, really cool neck range of motion increase exercise. Okay, I'm going to read, let's see, I'm scrolling to my right thumb while on my phone. Yeah, actually it's called, let's say, Emmy, it's called, there's a name for it, for the thumb thingy. And I get like a young people, yeah. So some of the things, those are like the gentle, just the basic stretches, you do like this, or you go like this, these things, or sometimes you would hold, let's say like this, hold your thumb and bend you'll feel that pull right on top. So you're getting your thumb down, you're holding your thumb and bending it like that. You should feel the stretch here and feels really good. As a massage therapist, when I used to do actual massages, we use our thumbs a lot. Oh my God, I used to get so much pain. But yeah, that would help a lot. And ice it, or I would kinesio-tape it. That
Yeah,
would
it's the
really
whole, if you don't mind me saying, because I've been sick, so I've been like in bed, just like scrolling my phone to like pass the time. And then I was like, why
Yeah.
is my arm so sore? And at first it was just this, like the top of it. And then it's all the way up this whole top of my
Yeah.
arm even today.
Or
So I
I
just put
would
myself
get,
on a phone break. I was like, I kind of figured it was because I've been holding the phone and scrolling at the same time with my thumb. Don't do that, guys. Don't do that
yeah,
too
I would
much. Don't
also
really realize
get,
you're doing it until it hurts.
you can also always use a lacrosse ball. Like I have it under my desk all the time. So lacrosse ball you put on let's see if I can, let's see, would I be able to show you
Cool, because
guys?
I have a lacrosse
Yeah,
ball already.
you put like this and you roll back and forth like that. Okay, you can do against the wall. That way you can lean with your body weight to put more pressure on it. So you can go like that. Also, you can do the opposite, like that, the top. So lacrosse ball is, I absolutely love lacrosse ball. So that's something you can definitely do as well. Okay. Yes, take break. It can be done and really tight shin ligaments. Oh, yes. One of the really cool things with the shins, I would say definitely kinesiotaping to relax the shin muscles, the shins right in front. Are you familiar with kinesiotaping? Sophia,
No, not taping, no.
Kinesiotaping, you've seen, if you ever watch sport, you see a bunch of athletes have all these colorful tapes on
Yeah,
them.
okay. Yeah.
Yeah, so there is a way, and if you Google, like on YouTube or Google it, how to tape the shin, kinesiotape the shin, that
Yeah.
would be one of the easiest ways. Or you can do foam rolling. You just need to make sure you're doing it properly because you cannot foam roll on the bone. You need to turn sideways. Make sure you're only getting the muscle and not the bone. So, but the kinesiotaping, because you can actually tape it yourself. It's really easy to tape. You just have
Yeah.
to know how to tape it properly.
Yeah.
So if you Google it, that would be, see, Laura comes to rescue. Laura just put a thing. Yeah. And for the flat foot, there are several exercises you can do. You know, one of the best things is doing, again, lacrosse ball exercises, but also if you can go outside, gather a few pebbles, put it on the floor and try to collect the pebble, like pick up with your toes and move it, put it to the other side. So
Yeah.
this is what you're doing. And that would actually help to create more arch, help those muscles. A lot of times the doctors say, you know, get a special orthotics made with your foot mold. I'm not a big fan of it. I'm a barefoot person. Like I wear barefoot shoes. When I used to run with the barefoot 5-toe shoes. I've never been a fan of arch support. But again, if you do the exercises, you know, it will take some time, but it will definitely help create some arch.
Yeah, the pebbles, thanks. I forgot about the pebbles. I've done
The pebbles
done
are
it before,
really
but I forgot
cool.
it. Yeah, it's good. Thank you.
Thank you, Laura. Thank you, Jennifer. Let's see, schedule for schedule for neck injection. Is it cortisone shots? Jennifer, is it cortisone shots?
I think it's a nerve block.
Oh, they're gonna block the nerve.
More like a lidocaine thing than a
Oh, you have
cortisone.
Sjögren's syndrome. Yes.
So
Okay.
yeah, and so yeah, but it just was like Tyson like mentioned this about 1 second before we hopped on, and everything applied to me. You know, like the jaw, the tongue tie, the neck, everything was so apropos. It was like ridiculous, Tyson. You just like were like, oh, this call's happening in 7 minutes, and I hopped on.
So the tongue tie, I do have a local practitioner that I have sent several of my patients to get it snipped on the thing because.
Well, the thing that's really funny is my office maid is an OMT, and she has recommended this, but my insurance won't snip it. And so I have been in a circular argument about that. And so, but I have like, you probably know this, like the backs of my cat tie, which is apparently
It goes all the way down to, like, sometimes I have clients with the lower back issues and I release their jaw, their tongue, and the lower back just completely releases.
Yeah, but I could feel that when you did when you told us to pull our tongue out, like I could feel that like release in the back of my neck.
Well, another technique you can do with the tongue is when you can open your mouth slightly, curl your tongue to the roof of your mouth, one hand inside the mouth, one hand like under your jaw, just behind your mandible bone. Imagine you're doing this. So you're
Okay.
going like this,
Uh-huh.
and it's
Okay.
painful. That's part of the tongue release. When I do at the office
Yeah.
with the clients, like men sometimes they tap on a table, like
Yeah.
I'm done, or the tears start coming down,
Oh,
and I tell them I have one request I have: do not bite my finger. That's it.
oh yeah.
But if you do that yourself, you will get so much release. But whenever you can, please get that tongue tie snipped.
Well, it's funny. Tyson doesn't know this about US insurance, but in the United States, like if your insurance doesn't cover it, you like have to like, you know, I mean, pay thousands of dollars out of
Well, I would go
pocket.
to honestly, I would go to a doctor and see if they can do what would they charge to pay cash and just set
Yeah.
up like a payment plan, or sometimes they give you like a really, really good price. One day I was at my mom's cardiologist and they were doing echo. And I said, oh my God, that looks so cool. I want to see what my heart is and all the colorful, fluids, blood going in and out. I'm like, how much would you
Really?
charge if I paid you cash? He's like, $150. I'm like, done.
Na pravda.
So you never know, it's just a one snip. In the old days, when children had newborns, when they had tongue tie, the doulas or the nurses, they had long nail. They would just snip it with their nail, that skin, and that's it.
Wow.
That what they used to do in the old days.
Okay.
Thank you, Sandy. Let's see. Oh, good. Do we have stretches for patellar tendonitis? Wish I could get my hands on you. With the tendonitis, definitely, it's an inflammation. I mean, you're constantly with your running cane, you're constantly aggravating it. But one of the things, if you can get someone release the oh my God, what's that muscle behind the knee? Oh my God, I forgot the name of the muscle, popliteus. If someone can release your popliteus, which sits in an angle back of your knee, I guarantee that's what's one of the things is tied on you. Try to find where you are. Try to find a practitioner that does trigenics. Let's see, I can type it here, trigenics. See if you can find, I do trigenics. I actually went to Toronto to study, but trigenics, they do this unique, amazing techniques. If you can find a practitioner, do that on your knee to work on your knee. Oh my God, you're going to be like the happiest guy. But tendonitis also cold lasers. If anyone has a cold laser machine, red light, infrared, that wavelength would calm down the inflammation. But at the same time, because, most of the time with the patella, it's anything with the knee, it's your thighs, your hamstrings, your calves, your shins, your ankles. You need to relax them, loosen them up constantly, either with the foam roller, with whatever someone is stretching you doing, but that's something you really need to concentrate on. But I would say trigenics and icing, even ice baths. Oh, have you done cryotherapy? That would help with the inflammation major.
Yeah, not cryotherapy, but I've done ice baths. It's funny you say like what started it years ago was getting kicked in a tournament and tore my hamstring. So, so that as that healed, that impacted the knee. So, but now it's just managing it. It's just when I'm doing really high mileage is only when I really,
Okay.
notice it. So I'm always looking for good stretches to kind of
Why don't
manage it
you
in advance.
tape it before you run, before your major runs. Have someone or you tape your knee. Kinesio tape your
Yeah,
knee.
that's actually a good idea. Yeah. Yeah, I haven't had anyone
do
to
it.
do that.
You can easily do it yourself. It's so simple. I'll be happy to later. We can hop on and I can walk you through how to tape different ways to tape your knee. But I would do
Yeah, no,
that
that'd be.
with every run. Yeah.
Will that hold up when you're crawling under barbed wire through mud? I gave up on that. 'cause
Depending
I
on the
couldn't.
tape, yes. Depending on the tape, because with the showers, I used to do obstacle course races, and they held
Yeah, yep.
up.
Okay,
They
cool.
held on,
No,
yeah.
I'll definitely give that a try,
If it's
especially
a
when I'm
tape, if
doing
it's a
3
good
races in
tape,
a
it would
weekend,
hold on. Yeah,
Cool. Cool.
definitely. Does anyone have any other questions? Okay, I want to teach you one more technique, if that's okay, Tyson. Because everyone can use this, as we're talking about this time of the year with, holidays, stress, your family's getting together. So sometimes it's a good thing. Sometimes it's a major stress. Like I love my family, but in a short periods, like an hour, 2 hour, that's it. Yeah. But so as with stress, like I said, it can affect our breathing because we do a lot more like a shallow neck breathing. So you can utilize some of the neck techniques that I taught you. But at the same time is when you're doing a lot of shallow neck techniques, then your diaphragm becomes really tight. And one of the reasons when I go and palpate around the rib cage, 6 to 12 ribs, it's because your diaphragm actually attaches 6 to 12 ribs. But when I palpate 6 to 9 ribs, when someone feels ticklish, it's because their diaphragm is tight. Now, when you ever look at the anatomy of the diaphragm, not only it attaches to your ribs, but it also attaches to the base of your sternum, your xiphoid bone right there. In the lower back, it attaches to your spine, your lumbar vertebrae, and then it also, the fibers of the diaphragm, they cross over your lower back. So when you have tight diaphragm, everything gets affected. It's not just your diaphragm. So this technique will help you release your diaphragm, and you can do it laying down, sitting up, standing up, doesn't matter. It's awesome. It works. Kids love it because when I go and palpate the kids, they're ticklish, and then I teach them this technique, and then they're not ticklish anymore. They think it's really cool. All right, so you're going to turn your head to the right. Your left arm reaches down. You're not tilting your body. It's just the arm reaching down towards the floor. And all you're doing is belly loud coughing, like 4 or 5 good coughing, like that's it. And then now you turn your head to the opposite direction. So now if you're turning your head to the left, your right arm reaches down. Give like about 4 or 5 good belly cough. That's it. That releases your diaphragm. Now, if any of you have children, let's see, I'm going to share my screen and show, and I'll put the link that you guys can download. On my website, in the resources, you can download, it says fast stress relief. This is amazing, especially for children. It'll take a second, it will come up. But this is so cool to teach children stress relief. And I was told it works all the time. And it tells you, explains you what all these points mean. If you've ever been to, here, I'll put the link. If you've ever been to, let's say, Korean acupuncturist or traditional like Chinese medicine acupuncturist doctors where they do pulse reading. If you ever been, I don't know, I love it. I used to have my Korean doctor before he moved. So this link, it will take you to my resources page, and you saw the top, the fourth one. Just you can just download it, open up that PDF and download it. But you can teach your children and use them. So it uses those 3 different pulses, and on the right and left hand side, they have completely different meaning. And children, they just love it. It's such a cool thing. You can do this as you're holding the points, and hold that, and then you do the same thing opposite, and that's all there is to it. So it's a really cool technique to teach children for stress relief. Any other questions? Anything else?
I think we're all good. Do you have anything that comes to mind? Esther, go for it.
Anything else about head? Something behind my eyes, just like right here. And I don't even call it a headache. It's really tight here.
So that could be a tension, because that could be tight muscles. Okay. When you look up the anatomy, the muscles here goes all the way back to your subscapularis, to all the way back of the base of your neck. So when you have tension tight back of your skull, you could feel the headache here. Now, I don't know if you have any allergies, because the sinus can contribute to it. Do you?
I don't have allergies, but I do have issues with light in my eyes, which is why I wear these blue light blockers all the time.
So, few things you can do actually would help, and it feels really good. Sometimes it could be painful. I would just grab here and pinch it hard. It would hurt, but it's like good hurt, like you're pinching your eyebrows.
Yeah, got it.
And go
Oh,
around.
that feels good. Oh,
Yeah.
thank
Oh,
you.
yeah. No, that's amazing. Like when you listen, sometimes if you follow the Taoist practitioners or the Chinese healers, the eyes massaging here, it's major, major, major. So not only pinch around it when you have tension, it hurts. But like I said, it's a really good hurt. So
that's great. Thank you.
Yeah, about 10 times I would pinch that, but I would also push right here and hold it, and close your eyes and just hold that. And anytime, especially when you're sitting in front of a computer a lot or wearing your glasses a lot, I would just take it off and just do some strokes like this and just massage.
Wonderful. Thank you.
Really
It already
good.
feels better. Thanks.
Yeah, if you were here, I would teach you how to use cross balance tape and tape it, which is more of a Japanese Korean, but they call it acupuncture without needles. So that would be really helpful. Okay, hopefully that was helpful. Tyson, you were saying?
Yeah, I mean, while we're kind of wrapping it up, I thought if you have any other techniques regarding any common pain you might see quite frequently, whether it's back pain or shoulder pain or neck pain, is there any other release techniques that you think could, help the majority of people who generally have aches and pains?
Yeah, one of the a lot I see besides neck pain, back pain is plantar fasciitis, foot pain. I see a lot of plantar fasciitis, and to a point that sometimes people they go and they get injections done on the bottom of their feet, and that is painful. So there's a really cool technique, exercise for plantar fasciitis that I teach people. So what I'm going to do is I'm going to take my camera and I'm going to bring it down and see if you guys can see my beautiful toes. Good thing is, let's see, right there. Okay. So this exercise is you're going to point your foot down and flex the toes up. And then you're going to flex your foot up, curl the toes down. And keep repeating. Sometimes it takes a while to get used to because you're doing like opposite. You're pointing your foot, curling the toes up, and then flexing your foot up, curling the toes under. Once you get the hang of it, you do that faster. That helps relax the ligaments on the bottom of your feet. And also try to foam roll the muscles around Achilles tendon. Because that I see a lot on people. So let's say that. And of course, shoulder pain. I see a lot of frozen shoulder, especially on women going through menopause. I don't know what is it with the hormonal changes, what happens, why it happens, but I see a lot of women, like clients, they come and they're like, overnight, I'm not able to raise my shoulders. So there's a technique that we can, I can teach. Okay. So, okay, this technique, I have to have someone, does someone has a shoulder issue that has a restrictive range of motion? Okay, so I saw 3 hands. Okay, let's do this. Now, if you bring your arm up, just, so you're gonna keep as close to your ear as possible, reach as far up towards the ceiling as possible without arching your back, and try to take as far back as possible. Now bring that down, try to do the same thing with the opposite arm, and tell me which side, which arm is the hardest for you to do. Is there a difference between right and left? Okay, now, whichever side was the easiest side, what you're going to do is about 20 up and down, like that. Just 20 times, up and down. You count, I'm not counting. Don't like wing it, but bring, 20 times. Once you're done 20, and then the next 5, what you're going to do is, as you're counting, I'm just going to tell you what you're going to do the next 5. You're going to slowly bring it up, bring as close to your ear as possible, reach up towards the ceiling as high as you can, and take it as far back as you can. That would be 1. You'll do that 5 times. So it's a slow one. You're really concentrating.
And then do you do that one again on the harder side?
No, only on easy side. Only on easy side. Once you're done, now if you're done, like all 25 altogether, now go back to your difficult side and tell me if that made any difference in the range of motion. Did it change? Stephen, it didn't. Okay, Esther says it did. Stephen says it didn't. Okay, then Stephen, I would give you another technique. What you're going to do is you're going to put your hands like this, turn one side, and then turn the opposite side and see which side is easiest. Then you're going to do 3 sets of 20 to the easy side, okay? But before you do that, assess your range of motion, like where it is, and then do 3 sets of 20 and then reassess and see if that increased. Even if it increased like 2%, keep doing it until it goes back to where it was. Again, I don't know if you have any any injury, any tears, any let's say, any buildup of anything, like a calcification, any buildup, I don't know. But a lot of times this technique will increase the range of motion.
What was interesting is the same side that I had the limitation on with raising is the same side I had a limitation on with the turning, but I have neuropathy in these two fingers on the opposite side.
Uh-huh.
So
You would
there's
be
a-
type of client I would love to get my hands on.
How much are plane tickets?
You can fly me out wherever you are. Give me a place to stay. I'll work on you for free.
All right, I have the place, North Carolina. It's warmer
That's
here.
it. Oh, I love North Carolina. As long as I can
You're
go and
welcome.
walk around, just fly me out. Give me a place to stay. I'll work on you for free.
All
I
right,
love it.
super.
Hey, Ani, we'll need to wrap it up in a minute because we've got the collaborative call starting.
Yes.
Everyone, was this helpful? So, Ani, can you please I know you put your website and things down in the chat. Would you be able to let us know where would you recommend people go to follow you, get more techniques, reach out for further help?
Definitely my website. Like I said, I have some free resources that you guys can download. You can actually sign up in my homepage. When you click on my website, in my homepage, I have two things. Well, there is it says top 5 body pain hacks. When you sign up, you get for the next 5 days, you get 2 to 3 minute videos of different techniques for back pain, for neck pain, I think diaphragm, whatever you get, like for 5 days, you get short videos of techniques and downloadable PDFs.
Beautiful. Awesome. Everyone, add Ani to your network if you don't have her already. Reach out for any further questions.
And Amy, I'm in Los Angeles.
And see how you can be of support. See you can help Ani and see where these techniques help you, and definitely let her know whether you want to give her a testimonial, case study. Let her know if these techniques work, and just write up something really quick for her, because that'll be a really good help for her website and everything like that. So Ani, thank you so much.
Thank you, Tyson. Thank you so much, everyone. You guys were a good crowd. Thanks for the questions, and we'd love to hear the feedback. Yes.